we should be expecting as we now move into the next stage of the implementation of the Affordable Care Act. First of all, here we go. So let's first of all make sure that we are on the same page about why we need the Affordable Care Act and for what reasons that law was passed. Mainly it's because 48 million Americans are uninsured, and they're uninsured today because by and large private health insurance has been unaffordable for people who are not offered insurance through their jobs. And there are very limited consumer protections so that people often were not able to get health insurance even if they could afford it because they have a pre-existing condition or they had insurance and got sick and that insurance was taken away. In addition to that, access to the Medicaid program really varies depending on where you live. We wanted to make sure that people would be able to get health coverage even if they have very, very little income, which today is not the case, but is changing very soon, as we will discuss in just a moment. So these were the reasons that the Affordable Care Act was passed, and the things that we are really expecting to be fixed now that it is going into a full effect. So let's talk a little bit about what's happened already. Already, children with pre-existing conditions cannot be denied health care coverage in the individual market. They must be given plans. Young adults up to age 26 can be on their parents' health insurance, and they can stay there until they turn 26. And 3.1 million young adults have already gained health coverage because of this very, very important change. And there's already been a temporary high-risk pool established for adults who have pre-existing conditions and were unable to purchase a health coverage plan in the private market because of that pre-existing condition. So some of these problems have already been addressed. Preventive care is now being covered at no cost to consumers. Insurance companies are no longer allowed to drop coverage just because you get sick, and they're not allowed to have a lifetime cap on the amount of care that someone can get while covered by that plan. We're also doing a lot to help control the cost of health coverage. Health insurance companies are now required to spend 80 to 85% of their premiums that they collect on actual medical care, or to refund consumers the amount that they were overcharged. It basically limits the amount that health insurance companies are able to spend on administrative costs, on advertising, on other things unrelated to actually providing medical care to their subscribers. And there's new oversight of premium rate increases so that insurance companies have to justify when they're raising their premium rates why that's happening, and show insurance commissioners in each state that that premium rate increase is warranted. And insurance commissioners have the ability to say no, that you're not allowed to do that. We have some tax credits for small businesses that are now in place. Small businesses have been able to get these tax credits to help them buy coverage for their employees. It's also available to nonprofit organizations as well as for-profit organizations. And many, many small businesses have been able to take advantage of these tax credits in order to start offering coverage to their employees. And we've also improved the Medicare program. There is, as some people know, a donut hole in the Medicare Part D program, which allows seniors to buy prescription drugs. The donut hole meant that seniors were really forced to pay a lot of money out of pocket in order to get their prescription drugs, and this is being closed each and every year. Free preventive care for people in Medicare, and enhanced payments for primary care to certain physicians and general surgeons, which means there's more availability of doctors and surgeons to people who have Medicare. So these are some really, really important provisions. But that really is just the beginning. There's a lot more coming starting in just a few weeks on January 1, 2014. Stronger consumer protections. In addition to the consumer protections we've already discussed, insurance companies will not be able to deny or exclude people because they have a pre-existing condition, and that's particularly important for this group, but for many, many people who have a pre-existing condition, and insurers really used to have carte blanche in deciding what was a pre-existing condition and whether they were going to charge more or prohibit somebody from getting coverage just because they seemed a poor risk to an insurer, and that's no longer going to be allowed. There is no annual limit. In addition to what we talked about before with lifetime limits, insurers are also not going to be able to have an annual limit on the amount of coverage that they will provide somebody, the amount of care someone can get. And so that's going to be really, really important for people who are actually utilizing their insurance because they have medical needs. And insurance companies will not be able to discriminate against people for having a pre-existing condition or by gender or occupation. And this is particularly important. A lot of us remember when we were debating the enactment of the Affordable Care Act, and there was a lot of discussion about how women are generally speaking charged a lot more for insurance just because they are women. And insurance companies won't be able to do that or to charge somebody more or prevent them from getting coverage because they have an occupation that leads them to need insurance more. People are going to know what's covered by their insurance plan, and this is really important because in the past it has been very, very difficult to get information in an understandable and clear way about what insurance plans in the individual insurance market actually covered. And there's a list now of what is deemed essential minimum services, and all insurance plans have to offer these services. And that's really important because it means that we have a better way of comparing plans, because you can actually look and see what are those categories of services and how are plans covering them and under what circumstance. And that's going to be, again, very important going forward. And it's going to be a lot easier to shop for health insurance. A lot of people say that in the past they have not been able to buy insurance because it was really complicated to figure out what insurance was covering, to even figure out where to go to look for it. And now we're going to have health insurance marketplaces in every single state. That's a one-stop shopping experience so that people, individuals, families, small businesses can go to one place. They can find all of the plans that are offered through the marketplace. They can compare the costs. They can compare what is covered and when. And they can apply for financial help with the cost of that coverage. And so you may have heard a little bit about the marketplace in your state. And these are now up and running, and this is going to be a really much more streamlined way to shop for health insurance coverage going forward. Not only that, but coverage is also going to be much more affordable. New tax credits will help moderate income people afford health coverage. You can get them if you apply for coverage through one of those state marketplaces. Sometimes they're called a health insurance exchange. Sometimes they're called a health insurance marketplace. It may have its own name in your state, but they are in every state. And when you apply for coverage through one of them, if you have income between 100 and 400% of the federal poverty level, which for a family of 3 is $19,000 to $77,000 a year, you can qualify for help with the cost of your health care coverage. And the help, people at the lower end of that income scale will get a greater amount of help. People at the higher end will get somewhat less. But this is brand new and is really going to be very important for helping people who haven't been able to afford coverage get coverage now. I think we mentioned a little bit about the fact that there's no caps on what insurers will pay for, but there are going to be new caps on what people will have to pay out of pocket for essential minimum benefits when they get that care. Those annual out-of-pocket costs are $6,350 per person or $12,700 per family, and that doesn't change based on the family size. That's true for any family of any size. In addition to those limits, there is new help with cost sharing for people with lower incomes that can make that $6,350 or $12,700 a lot less for people. You have to buy a silver plan, and plans in the marketplaces come in a variety of different categories, and they're all labeled bronze, silver, gold, or platinum. But the cost sharing help for people with lower incomes applies to certain kinds of silver plans, and so you're going to want to watch for that if you're a person who can qualify for that cost sharing help, and make sure that you're buying the right plan to be able to get that help. Now, every state, as I mentioned, has a marketplace. Some of them are run by states, and some of them are run by the federal government through the Department of Health and Human Services. And then there are some states where the federal government and the state governments are partnering to administer those new marketplaces. From a consumer perspective, the most important thing to know is that if you're in one of the states, either one where the federal government is running the marketplace or it's a partnership, that the application for coverage goes through a central source at www.healthcare.gov, whereas if you're in one of those states that in this map is colored light blue, it's a state where your state is running the marketplace, the URL to get information about how to apply for coverage could be slightly different from that, although you can get to any state's marketplace by going to www.healthcare.gov. States that are running their own exchanges have some flexibility to decide how the marketplace works, what plans they're going to come in, and how much they're going to do outreach and education, and many other things. They have control over that. And they're able to, so there may be some differences state to state in how some of those things look within the marketplaces, but the rules about who can get coverage and the transparency and information that is provided and the financial assistance that is provided are consistent. They are true in every single state. So consumers are going to save a lot of money, mostly through the financial assistance that I was talking about a little while ago with the premium tax credits. You can look at this chart, and it's a lot of numbers there and a lot of columns, but the bottom line is someone with an income, if you look at the right-hand column here, with the Johnson family, has income of $35,000 a year. If they look around and they find a plan that meets their needs, and that plan cost is $12,500 a year, they aren't going to have to pay that full $12,500 a year, which, as you can easily see, would have made this plan completely cost prohibitive for them if they were buying that today or last year. Instead, they're going to get a tax credit of $11,090, which means they're only going to have to pay $1,410 towards the cost of that coverage out of their own pocketbook. And that is really, really crucial because, as I've said before, the most important thing that is preventing about 48 million people from getting health care coverage today is that they simply can't afford it because health coverage is so expensive. And so these premium tax credits, this financial help, is going to be really important for making sure that more people can get health coverage. But it's not the only way that access to coverage is being improved. There's also an expansion of the Medicaid program that, again, operates in every single state. And the law called for an expansion of coverage to 138% of the federal poverty level and provided an incentive for states to expand coverage by providing 100% of the cost of that expansion. So some of you may know that the Medicaid program is jointly funded by states and the federal government, and states put in a share and the federal government puts in a share, and the average of those shares is that the federal government pays by and large a little over half of the costs of Medicaid coverage, generally speaking, and states put in a little under half. However, not everyone today who has low income can get into Medicaid. You have to be a child or a parent or a person with a disability or a senior citizen or otherwise fall into a special category that allows you to be eligible for Medicaid. This expansion means that anyone who has low income under 138% of the federal poverty level can get into the Medicaid program. And as you can see, a very large percentage of the uninsured will qualify for Medicaid if every state expands coverage. However, as many of you probably have heard, last summer the Supreme Court had a ruling about the Affordable Care Act, and what they decided was that states did not have to expand Medicaid. They were allowed to choose whether or not they wanted to do that Medicaid expansion. So over the last year or so, states have state leaders have engaged in a lot of debate about whether to move forward with that Medicaid expansion. And at this time, 25 states plus the District of Columbia, and those are the states that are highlighted in green on this map, are expanding Medicaid to 138% of the federal poverty level. A couple of those states have somewhat higher income levels for Medicaid, but what this means is that in approximately 21 states, they've decided not to move forward with a Medicaid expansion at this time, and in a few other states, they're still debating it. The bottom line is that if you are in a state where there is a Medicaid expansion, there's a continuum of coverage so that you know you can apply for coverage through an exchange, through a state marketplace, or through a Medicaid program, and you'll be able to get coverage. In states that haven't expanded Medicaid and they're choosing not to do that yet, they can still decide to do that even after January 1. They can decide to do that at any time, but until they do, in some of those 21 states, there will be a gap in coverage between the state's current Medicaid eligibility level and 100% of the federal poverty level, where people will be able to get subsidies, financial help to get coverage in those marketplaces. And it means that Medicaid coverage is still going to be limited to specific groups of people, and there will be people who have very, very low incomes who still won't be able to qualify for Medicaid, unfortunately. So we estimate, and these are figures that we got from the Kaiser Commission, Medicaid and the Uninsured, that about 4.8 million people are going to fall into that coverage gap based on where we stand now in terms of states moving forward. And as you can see, the bulk of these people come from some of very large states that have decided that so far they're not going to expand Medicaid. Again, this could change, and you should pay attention to what's going on in your state. If you live in one of these states that is so far not deciding to expand Medicaid, that could change in the future, and so you should pay attention to see whether that might be an option for you at some point in the future. As I said, and as we are going to see in a number of states where they are expanding Medicaid, there's going to be a continuum of coverage, and this is really different because what we've had so far is kind of a patchwork of coverage where some people might be able to qualify for Medicaid and some people might be able to afford a plan in the individual market. Other people get their coverage through employers, but a lot of people are left out of that because they don't fit one of those categories for Medicaid, or they have income that's too high to qualify for Medicaid, but they can't afford the plans that are offered, or again, have a pre-existing condition and health care needs that are keeping them out. And all of those things are changing so that there is a healthcare system, there is a place where people can go to apply for coverage and know that they can come out with something. And I think that providing that stability in the health insurance market is going to be really, really important for our nation and for people who need healthcare and health insurance. So how can you get signed up for coverage? Enrollment is already underway. Open enrollment started October 1 and runs through the end of March 2014. It looks like I have an error on my slide, but I wanted to just note for you that that is October 1. And people who are interested in having coverage by January 1 need to be enrolled in coverage by December 23rd, which is coming up in a little over a week and is a very important date if you want to have your coverage starting on January 1. But that's not the end of the story. You will have until March 31st to sign up for coverage for open enrollment this year. And then from March 31 to November 15th, 2014, you'll still be able to apply for Medicaid for Children's Health Insurance Program, or if you have a change in circumstances, like you get married or you get divorced or you lose your job or lose your insurance, then you will still be able to apply for coverage in that interim period until open enrollment starts again November 15th, 2014, which will run to January 15th, 2014, where there'll be another open enrollment opportunity for folks in this year. Now this year is a little bit different from future years. In future years, every year, starting in 2015, there will be an open enrollment period from October 15th to December 7th, and that part of the slide is correct. And so that'll be your opportunity to change your plan, to check again to see if you might qualify for a tax credit if you've had a change in your income or a change in your family size. And every year after that, you're going to want to pay attention to that open enrollment period. But do note that there are ways for people to apply even between open enrollment periods, again, if you've lost your job, if you've lost your insurance, if you had a change in circumstance. As I said, December 23rd is a really key date, and it's coming up, and so we want people to be paying attention. There is still time to apply for coverage. It's not too late. We are a little over a week away from this date. And it is important for people, if you think you might want coverage or might need coverage, it's important to go check it out. You can go to www.healthcare.gov, and I know there's been a lot of concern in the media about the website not working and people being unable to get through the application process. And, you know, a lot of that, frankly, was true. People have had a number of challenges as we've launched this really incredible change in our healthcare system. There were some serious technology problems that meant that that website was not working as well as it should have, and it's been harder for people to apply for coverage. But it is working a lot better now, and it is definitely worth going to take a look. And the application process can be very, very fast, so it is definitely still worth looking into if you are interested in getting coverage. And if the website isn't working for you, or if you don't have internet access in a place that's convenient for you, there are other ways to apply by phone, by mailing a paper application. I would say that the paper application is not going to be quite as fast, so if you start a paper application today, you may not be able to get coverage January 1, but you'll still be able to get it in February. Or by going to a local in-person assister who can help you get coverage, and you can find those people by going to localhelp.healthcare.gov and putting in your zip code, and then you'll get a list of people in your area who can help you through the application process. So far, despite the fact that there have been a lot of challenges getting through that application process, what we've seen is that there is a tremendous demand for coverage. A lot of people are very, very interested in getting health care coverage. Over 1.8 million applications have already been filed as of November 30th. And by the way, I think we all expect that these numbers are going to go up significantly in December, because this is the time period when people are really starting to think about what they need in January, and the website is getting a lot better, and the application process is going more smoothly, and more people are hearing about the fact that there's coverage available. Those 1.8 million applications cover more than 3.6 million people who are applying for coverage. The vast majority of them have been determined eligible to purchase a plan in the marketplace. Nearly 1 million of them have been found eligible for some financial assistance and help with the cost of coverage, and more than 800,000 have already been assessed eligible for Medicaid. And 365,000 people had already chosen a new marketplace health plan as of the end of November. And again, I think a lot of those people who've been determined eligible to purchase are going to be actually finalizing the process and choosing their plan right now so that they can get their coverage January 1. There are some resources. This was actually from a different presentation that I did not too long ago that was more focused on providers, but I thought some of these might be useful for folks on this call, because they really are education materials about things that patients need to know, things you need to put together in order to apply for coverage, and so it's definitely worth checking out if you want more information. There's also a lot of information at healthcare.gov, as well as the application itself. There's also a lot of information about what healthcare is, how to use it, and what different plans are offered in your community. And that's something that was recently changed about healthcare.gov. You had to, before, you had to apply for coverage in order to see what plans are available. They've fixed that, and now you can shop, you can window shop and look around at what plans are available and what they're likely to cost before you decide whether you're going to apply for coverage or for financial assistance. Lastly, I really just wanted to put in a plug that if you've gotten coverage and it is helping you and helping your family, we want to hear about it. We want to hear about it because sharing the stories of people who have already gotten enrolled in coverage is a very powerful way to encourage other people to sign up. This is all very, very new, and the more that people hear that people just like them are getting help, they're getting coverage, they're getting the health care that they need, the more likely they are to sign up for coverage if they're a little bit unsure about what all of this new stuff is. And so if you share your story, we can help you share that more broadly, and you can really help a lot of people get into the same good position that you're in. So if you go to the website, www.mycoveragestory.org, there's a form where you can tell us your story, and we'll be in touch with you to learn more and talk with you about how we can help you share that story more broadly. And with that, I think I'll turn it over to questions.
Great, Rachel. Thank you so much for a very informative presentation. I'm sure many of us on this call today viewing this webinar are very informed and feel a lot better about what to expect in 2014. Now I'm going to open the lines for questions at this time. You may also write your question in, and then I will read it for our wonderful presenter today. And it looks like we have a question. It says, I live in North Carolina and I don't see my hemophilia medication on the marketplace plans. Does that mean it isn't covered?
Not necessarily. Although I talked about how insurance companies have to be much more transparent about what they cover and when, we're still learning a lot about how to do this. This is all really brand new. So there are ways to find out if your particular drug is not listed in the formulary on the website. The next thing I would do is start calling the insurance companies that you're interested in and asking them about coverage for your drug. Prescription drugs do fall into that minimum essential benefits package, but insurers don't have to necessarily cover every single thing. They have to cover 1 or 2 drugs per class. So it may be that there is a different drug that isn't the one that you're taking that is covered, and you could find that out by calling the insurance company. If you call the insurance company and you still can't figure out whether or not they're covering the drug that you need, another thing to do would be to call the insurance department in your state, because all of those companies had to file information with the insurance department about what they were planning to do, and the insurance department had to approve whether or not they were going to put that plan in the marketplace. And they can also tell you, they can help you find out whether that drug actually is covered or whether you might need to file for an exception, which you can do with your insurance company. And I will just note that in North Carolina, as well as many other states, there's a really good consumer assistance program. In North Carolina, I believe it's called Smart NC. They are called different things in different places, but you should check with your insurance department about finding a consumer assistance program, because they can also help you navigate that process and figure out what's covered and how you can get it covered if it isn't.
Okay, so even if it isn't covered, then there's an opportunity to file for an exception?
That's right.
Okay.
There is a process in place where people can file for an exception that says, even if this generally isn't covered, it's something I really need and I would like it to be covered for me.
Great, great. And also for those who are listening and watching, please also let the Hemophilia Federation of America know if you do run into that problem, because we would absolutely like to be a partner with you to ensure that you are able to access your medication. Another question I have, my husband's job will not offer family health insurance next year. Do I have to include his income on my Marketplace application?
Yeah, you do. The application is in addition to telling the Marketplace who you want to have covered, it's also telling the Marketplace what your family income is. And you have to report income for everybody in your household and everybody that you would otherwise report on your income tax. And so it's really, really important that you do, even if you're not asking for coverage for your husband or for another member of your family.
Okay. I have another question. I've been trying to sign up on healthcare.gov, but I have not been able to get through. What am I supposed to do?
It's been a problem that healthcare.gov, as I mentioned, has not been working as well as we would have liked it to in the early weeks of open enrollment. But from everything I understand, it is working a tremendous amount better now than it was in the past. So it's definitely worth going back and trying again. If you can't, if it's still not working for you, I would try calling the call center, and you can get that phone number from healthcare.gov. I think I had it listed on a previous slide here. But you can get that information from healthcare.gov, and then the other option is to go to an in-person assister in your community and ask for help there.
Okay, and we will absolutely make these slides available, so all of the links that were shown today you will have access to. Okay, I have another question. If you started a job and insurance is delayed until March, can you apply to get coverage by January and then cancel later?
Yes, you can. If you have a change in circumstances, like an offer of insurance that you know is going to be coming at some point in the future, that qualifies as a special enrollment issue. So you can either in the middle of the year decide to apply for coverage in the Marketplace because you've lost your coverage, or if you have Marketplace coverage, you can cancel that coverage if you get an offer of employer-sponsored coverage during the year. So yes, I would definitely do that.
Another question. I signed up for health insurance, but I haven't heard back from the insurance company. How do I know if I'm covered?
Well, the best thing to do, especially given that you need to have already enrolled, which means made your payment for your first month by December 23rd.
So not just submitted the application, but actually made the payment.
That's right. And that date, that magic date, is the 23rd, although note that for some insurance companies it might be slightly different than the 23rd. It's really important to get in touch with the insurance company at this point. If you've made your application and you know it's been approved and you've chosen your plan, but you haven't heard back from the insurer of getting an invoice, for example, I would call the insurer and ask them and make sure they have your information. Ask them what is the date that you have to make that first payment by and get all the information, send your check in. That's what I would do. Now, if you call them and they say they don't know, if you've just made your application in the last day or so, then I would give it a couple days and call back again. Sometimes those transfers are happening a little bit more slowly than we would like. But if you applied a while ago and you haven't heard anything and you call, hopefully they will have your information and be able to tell you how to make your payment and reassure you that everything is underway. If they don't, then I would get in touch with the call center at healthcare.gov and ask them to double check the status of your application.
Okay, great. Another question. Doesn't Obamacare limit the out-of-pocket costs to around the $6,000 you said? But is there help out there for that $6,000? I think this was the $6,350 cap for individuals.
Right. So there is for people who have income below 250% of the federal poverty level. They can get extra help with cost sharing and deductibles and things like that. Again, you have to buy the silver plan that qualifies for cost sharing help. And so you need to pay attention to that if you're someone who would qualify for that coverage. If your income is over 250% of the federal poverty level, then there isn't help with the cost of that $6,350 out-of-pocket maximum. However, it is really important to look at the plans because that amount of money, that $6,300, can be charged in different ways. So you'll want to look at the deductible for your plan, but you'll also want to look at what's included in the deductible. Some plans are excluding certain costs from the deductible. So they are saying before you even meet the deductible, we're still going to let you have a smaller copay for going to the doctor, or for certain prescription drugs, they might say, is not part of your deductible. So you're going to want to see what is the cost sharing in your plan, how is it charged, and for what services. And there are differences between plans on the market that are important to pay attention to.
Okay, but you would recommend for individuals who are interested in assistance that they start their first look, not to exclude any others, but start that first look at the silver plan.
That's right.
Okay.
That's right.
That actually goes well into the next question, which is, if I can't afford the high monthly premium for my health insurance, will I still be penalized?
So there are some limits, and so what's affordable and what isn't affordable has been defined in the law for purposes of that penalty. So if your offer of insurance would require you to pay more than 8% of your family income towards the cost of that coverage, then that is deemed unaffordable and you will not be penalized.
You said 8%.
8%.
Okay.
And you will not be penalized. But if you think that it's unaffordable, even when your out-of-pocket expenditures would be less than 8% of your family income, you still might be subject to a penalty.
Okay.
If you choose to not get that coverage. But what I would do in that circumstance is check to see whether you might qualify for a tax credit in buying a coverage through a marketplace.
And just for information's sake, when would that penalty need to be paid by? Would that be next year or 2015?
So the first time that the IRS is who collects those penalties, and the first time that they're going to be looking to see whether or not people have health insurance coverage is when you pay your taxes in April of 2015, or whenever you pay them between January and April in 2015.
Okay.
They're going to be looking back at 2014 to see, did you have coverage? Did you have coverage for all of the year, for most of the year, for some of the year? And they're going to be paying attention to that. So you're going to want to have coverage by the end of March in order to avoid a penalty. But it's okay if you don't have coverage in January and February. You won't be assessed a penalty. If you have coverage the rest of the year, you wouldn't be assessed a penalty.
So
and by the way, there are other reasons that people might be exempt from that penalty. The Secretary of Health and Human Services came up with a list of reasons that people might not be subject to a penalty even if they were uninsured for the whole year. And so it's important to take a look at that as well if you're concerned about that.
And is that list of exemptions, is that on healthcare.gov's website?
I believe it is.
Okay, great. All right, well, it looks like this concludes our webinar for today. Thank you all so much for joining us. Stay tuned for the wonderfully informative webinars from the Hemophilia Federation of America in 2014. Today's webinar was presented by Rachel Klein. Rachel Klein is the Director of Families USA's National Enrollment Assistor Support Center, which supports the work of health coverage enrollment helpers by providing training, technical assistance, interactive learning opportunities, and sharing best practices to ensure that consumers will have high-quality enrollment assistance. Families USA is a nonpartisan, nonprofit 501c3 organization dedicated to achieving high-quality, affordable health insurance coverage for all Americans. Before taking on this new role with Families USA, Ms. Klein was the founding executive director of Enroll America, a nonpartisan, nonprofit 501c3 organization that began operations in September 2011. Enroll America focuses entirely on ensuring that the uninsured who will be eligible for new health coverage in 2014 get enrolled in that coverage quickly and easily. Prior to launching Enroll America, Rachel was Deputy Director of Health Policy for Families USA, where she had worked since 1998. Ms. Klein directed Family USA's work on Medicaid and the Children's Health Insurance Program, or CHIP, coordinating federal initiatives to strengthen and increase coverage for low-income people, as well as providing technical assistance technical assistance to state-based healthcare advocates on a range of issues related to Medicaid and CHIP. Ms. Klein holds a master's degree in public policy from George Washington University and a bachelor's degree in political science from the University of California at San Diego. These slides will be made available, and please check the Hemophilia Federation of America website and YouTube channel for the presentation, as well as for an opportunity to have all of your questions answered. Have a great day.